grant money or emergency money available for you to hire more contact tracers if they're only getting through to 1/3 of the people that they need to reach in a day?
Yeah, so the governor announced there would be additional monies available. We're still working through those details. It's complicated about how to fund those, and unfortunately you can't build a contact tracer in a day. In fact, training our contact tracers takes away from our current contact tracing, so it's complicated. Certainly adding more would be helpful, but we can't add contact tracers fast enough to deal with a curve like this. We have to bend the curve.
There's a lot of people asking the question about when this will end, and we've heard a lot of responsibility put on the citizens. We do know this virus came from China and was manufactured there. We haven't seen any embargoes or any type of disciplinary action against China. So the people have two questions they'd like to ask. One to you, Dr. Sutter, about the Hippocratic Oath to do no harm. We do see a large rise in unemployment, alcoholism, domestic violence, depression. We're going to see possible famine from this low production here in the first world. With those questions out there, would you like to respond and how this order is going to set the people at ease when those questions are out there?
So there's a lot in that question, so I'll try and unpack a bit of it. First of all, I'm not aware of any convincing evidence that this virus was manufactured. So as best I can tell, and the experts I'm listening to, there is no evidence to suggest that it was manufactured. It did arise in China, I agree with that. So in the broader reach, this is continuing to spread. The fact that there's a global pandemic has significant social effects, which includes increased alcohol use, isolation, and probably increase in suicide rates. All those
Yes.
happen as a result of the global pandemic. Restrictions are a part of that, and they have to be weighed carefully. But there's not just one answer. It's about weighing the public good and trying to find a way that promotes public health and causes the least amount of injury. That's my goal with these orders, and I would say that they are thoughtful. I am paying attention to that. I'm paying attention to the economy, but my foremost goal, my foremost responsibility is to the health of this community. And that's why I chose to craft the order in this way.
Can I follow that up with the other side of the equation, which is politics? Man has been given a God-given right in our Declaration of Independence to life, liberty, and the pursuit of happiness. Of course, these mandates, these rules are limiting all three of those rights. How would you respond to the people that are asking what gives you the right to stop these three God-given rights in our Declaration of Independence?
So, yeah, the Declaration of Independence does mention that. And then the Constitution lays out what those rights will be. And obviously, I'm not a legal scholar. This is not legal advice. But the state has set this up, that the health officer does have the right, when there's a public health emergency, which we are currently in, to make restrictions in such a way to promote the public good. So while we have rights, and I'm completely, I love the fact that as Americans we have rights, those rights are not without limit. We have the right to free speech, but that doesn't mean we have the right to say everything. For instance, we don't have the right to yell fire in a crowded theater. So in response to that, I'm mindful of people's individual rights, and I'm also mindful of the public good and the community health.
Doctor, I have a follow-up question. Since this began, a lot of the population has said, it's just a flu. And with flu season coming, can you compare what you are seeing right now with what's happening to hospitalizations and death rates and infection rates for COVID versus what you would see in a normal flu season?
Yeah. So, I mean, as of yesterday, in our region, more than 1/3 of the ICU beds are filled with people who are positive for COVID-19. That is unprecedented. If you ask the people who actually work in the ICUs and work in the COVID units, this is something we've not seen before. When we saw H1N1, we saw a number of sick people, and we saw a number of people die, but we didn't see the hospitals filling up like this. This is really unprecedented in my career, in my 20-year career as an emergency physician, and really in my lifetime. This is an unprecedented public health emergency. That's that's watered down, I think, by the fact that most people will not get that ill. The majority of people will have mild symptoms that are something like the flu, but those who do get sick can get very sick. And when you look at how easily this is spread, it's a population problem. It's not that everybody who gets it is gonna die. It's absolutely not the case. But when
That's what
enough
Mayor
people
Henry
get
said.
infected, then our hospitals will fill up. Our hospitals will eventually have limited capacity, and we can exceed that if we continue with the cruise industry. I wanna see if anybody else has a question or
Brenda.
issues. Oh, yeah, hi.
You have not mentioned nursing homes and long-term care facilities. Can you fill us in on what's happening there and what measures have been taken to combat that?
Yeah, as you know, the state actually regulates long-term care facilities. That's not part of what the local health department does. As a result, I focus on the parts that I do have jurisdiction over.
So you don't have any insight into what might be happening there at all?
We know that those are our most vulnerable populations.
Yeah.
If you look across the state, nearly half the deaths that have happened have come from people living in long-term care facilities. There's an organized approach right now for testing for the workers to try and keep it from getting into long-term care facilities. However, many long-term care facilities do have cases within their walls. The biggest thing we can do as a community is to drop down the spread. Once we have increased spread within the community, it becomes almost impossible to keep it out of long-term care facilities. That's where, again, the most vulnerable people are and where we're likely to see the most deaths. However, it doesn't underlie the fact that more than half the deaths in the state have been people outside of long-term care facilities. People are otherwise independent and living life.
Doctor, I'm glad you're here. From a scientific approach, you give us facts. We just heard from Mayor Henry, believe me if I'm wrong, Mayor, that you said if you get it, you will die. Do you agree with Mayor Henry's comment?
So, yeah, I would not agree with the comment, if you get it,
Thank
you
you.
will die.
Thank
It's
you.
very clear that the vast majority of people will
Thank
not
you.
die. I met yesterday with the IU Fairbanks. We get a regular briefing from them. And based on their prevalence data for the state of Indiana, they're able to come up with a infection fatality rate. So what we've known before is a case fatality rate, but that's only the people who have positive tests. We know many people have had the infection, never got a test, and so aren't considered in that. And it's probably about 1/2 of 1%.
Yeah.
So if everybody gets the infection, likely 1 in 200 will die. From an individual risk perspective, my risk of dying of getting this, that's not that high. But if you look at a population of a state, or of a county, or of a country, or of a world, that's a huge number. And if we have the ability to bend this in the meantime, and then find safe and effective vaccines, there could be a lot of people who die if we allow them to get the infection that might be saved if we get the vaccine.
Is there any misinformation about there about people who test positive? How long should they be quarantining? It seems like there's information out there that if you have been symptom-free for 10 days, you can come back. Or is there any misinformation out there regarding that?
So as far as I can tell, there's misinformation on almost everything about COVID-19. It's difficult to find trusted sources on this. I continue to trust and refer to the CDC. I think they're doing a very good job. I think ISDH is doing a very good job. And I would also point you to our website. You can decide for yourself whether you think we're doing a good job, but I think we're doing good. So, you know, it's pretty clear this has changed. And what happens is, as we learn, when it is a novel virus, we don't know starting out. We're making educated guesses based on what we've seen with other viruses. As we collect more information, we tend to change our recommendations. And so early on, there was a lot of focus on testing to make sure that somebody was not infectious. What we know now is that many people, if you're using a very sensitive test like a PCR, will continue to test positive for several weeks after their infection. However, we have never isolated active virus from those people. So we think that that's just RNA left over, basically debris from the infection that's still continuing to test positive. So the current recommendation is for people who have mild to moderate illness, who are not hospitalized, and do not have immune system problems, that is, they're not on chemotherapy, they don't have a disease that affects their immune system, they will generally be infectious for 10 days after start of symptoms. As long as their symptoms are getting better and as long as they've not had a fever for 24 hours, and they do not require a follow-up test. For those who are hospitalized or those who have immune system problems, it's 20 days with the same restrictions. There are case reports of people who've been infectious for longer, but they're running fevers, and they have very special cases, like they're on chemotherapy for cancer and such. So it's a complicated answer, and it's isolation, not quarantine. Isolation is for people who are ill or positive. Quarantine is for people who are exposed, but not infected. But in general, for most people, it's gonna be 10 days.
It just almost seemed like if people were relaxing a little bit, that if you tested positive, but then you didn't show symptoms, you could come back to work in 10 days.
Right, so it seems, and in fact, if you test positive, you can go back to work 10 days after that positive test if you never develop symptoms. So what you just said there is correct. But people are confused, and frankly, it's
Yes.
complicated. It seems like every time somebody asks me a question, I could answer it first by saying, well, it's complicated, and then give them a 5-minute answer. And then sometimes I can give them a 20-minute answer with graphs and charts, which, you know, I've lost everybody by the first 30 seconds. So I wish I had very simple answers that are very easy to understand, and many times I don't.
Doctor, with increased testing, we're going to see increased positive cases. We just heard this week Elon Musk came out, a very smart man, had 4 tests done by the same administration, same person. 2 of them came back positive, 2 of them came back negative. With Mayor Henry really wanting to up the restrictions and our scientific community, I think, making the right call and saying we don't have the evidence yet, the people are concerned that the government is going to use this as a way to wield more power over the people. What assurance can doctors like yourself give the American people that you will fight for their freedom if the government does use fear tactics to control their lives more?
So again, a very complicated question.
Yeah.
Try and unpack it here. Let me be clear. I'm a physician, and I'm also part of that government that you're talking about. So, you know, what my
unelected.
assurance is what I'm trying to do is sift carefully through the scientific literature. I'm trying to pay attention to what the experts are saying and what the science is saying, and it's not always clear.
Yeah.
The experts don't always agree. It's how science works. And through that, make recommendations to elected officials based on this, and also choose what I think is the best for us.
Yeah.
Mayor Henry, I think you'd like to speak for just a minute?
Actually, what I'm going to do is I ask everyone to go ahead and save the rest of your questions for individuals up here. Dr. Sutter is so accommodating that he's staying up all day and answer questions. But the proper thing to do at this point is to go ahead and adjourn the formal press conference and make everyone up here available for individual questions.
Awesome.
Thank you all very much.
Thank you.